Welcome to the insulin resistance course for beginners. And in the simplest way, what happened is that our body cells, like muscle cells, fat cells, and liver cells, no longer want to respond to our friend insulin. Just like that.
That's why we see our poor pancreas screaming here and there like a madman. Because it's trying to keep blood sugar levels under control.
Oh dear! Insulin resistance, it's so annoying, and so are its guests. Who are these guests? The first one is high glucose levels. Mr. Glucose? Is there?
Yes, it is. I'm actually the star of the show.
And also, weight gain and fatigue. And even the occasional appearance of skin tags. Like I told you, it's a very boring party. Nobody wants to attend.
Okay. What are the main causes of insulin resistance?
First, obesity, especially abdominal obesity. And also, a sedentary lifestyle and lack of exercises. And maybe a few genetic factors.
When we combine all these factors, guess what happens? The result will most likely be type 2 diabetes. Indeed. The mix is complicated. What do you think?
Okay. How do I know if I have insulin resistance?
The answer is in the early stages of insulin resistance. You might not notice any obvious symptoms, meaning you're a completely normal person. Just like playing hide and seek. Until your pancreas can't keep up. When your insulin resistance increases, you'll notice the real symptoms.
Like what?
Like dark spots on the skin, increased hunger and thirst, blurred vision, tingling sensations.
The real danger in insulin resistance is the duo.
Who are they?
The collaboration between genetic factors and lifestyle factors. That's why we must face this duo wisely. Clear?
What is the primary culprit in insulin resistance?
Excess body fat. It's the main enemy in this story. Especially the stubborn visceral fat that accumulates around the abdomen dash. Just like an unwelcome guest.
Oh, the pain of laziness. You just sit there all day. Do you know this will increase your insulin resistance? And what if we add to that our bad diet, full of sugars, especially processed sugars? The result? It'll be a double blow to our slim bodies. Come on. Get up, let me tell you something.
It's time to get off that poor couch. And stop snacking on sugary treats.
Another hidden risk factor for insulin resistance syndrome is age. Yes, just like I'm telling you. The older you are, the higher your risk.
And what else?
Family history. So, you need to check your family tree.
Is there anything else?
Yes. If you have polycystic ovary syndrome, COS, your risk will be even higher. And one more thing, which is sleep apnea. Meaning you stop breathing while you're asleep. That's also a risk factor.
Okay. How can I be sure I have insulin resistance syndrome?
And the answer? Diagnosis. It's difficult, my friend.
Why?
Because there's no magic test here. I mean, if you go to the doctor, they'll assess your symptoms. And measure your blood pressure. And do some blood tests.
Is there anything more?
The doctor will also check your skin for dark pigmentation, which is medically called acanthosis nigricans. And then he'll measure your waist circumference too.
Your waist measurement is 40 inches or more. I'm talking about the man here. That means you're in trouble.
From the very beginning of the video. And you're giving me bad and negative news. Don't you have anything good to say?
Yes, I do. And the good news is that we can all, and often, control or even reverse insulin resistance. So how?
By
Changing our lifestyle. Lifestyle is the superpower here. Believe me, if I told you that if you lose even a little weight, this will change the whole game.
Okay,
How? Because your insulin sensitivity will improve significantly. Sports. Sports are also Superman's super cape.
okay. How?
It means combining aerobic and strength training. It will help your muscle cells use glucose very efficiently. That's why we must do our best. So what about food? The answer: say goodbye to refined carbohydrates and sugary snacks.
Okay,
And what's the alternative?
The golden alternative? Fiber and healthy fats. This is the healthy path you must stay on.
and what about medication?
Your doctor might prescribe some medication,
Like what?
like metformin, which increases insulin sensitivity, which is exactly what's needed. And that brings us to the end of the video. We solved the mystery of insulin resistance and how to treat it. I hope the information was clear and enjoyable. Take care.